Hey, welcome everyone, and thank you for being here today. We're here today to give an update on the critical rise in COVID-19 cases and important actions needed from all community members to control the spread of the virus. We will be hearing from a number of community stakeholders. Liane Jollon will give opening remarks, and she will be followed by Kym LeBlanc-Esparza, Superintendent of Archuleta School District, Dr. Rhonda Webb, CEO and Chief Medical Officer for Pagosa Springs Medical Center, Michael Murphy, Interim CEO for Mercy Regional Medical Center, Jeff Dupont, Associate Vice President for Student Affairs at Fort Lewis College, Commissioner Steve Wadley with Archuleta County, and Commissioner Gwen Lachelt with Plata County. There will be other panelists as well: Chris Mimak, Director of Department of Justice and Regulatory for Southern Ute Indian Tribe, Joe Theine, CEO with Animas Surgical Hospital, and Rocco Fuschetto, Superintendent of Ignacio School District. Members of the media can submit questions via the comments at any time during the press conference. If you have a question for a specific speaker or panelist, please indicate that in your comments. We'll do our best to answer as many questions as time allows. If we don't get to your question, we're available after the press conference for follow-up. The press conference is being recorded and will be available for anyone to view or distribute later today. With that, I will turn it over to Liane Jollon, Executive Director of San Juan Basin Public Health.
Thank you, Claire, and thank you to all of our panelists for being here today. This is really a community effort and a call to action brought to you by all of your partners who have been working together for months in this pandemic. So what we know about Southwest Colorado is that 8 months into this pandemic, we've really been an outlier in our success in fighting COVID-19. We have in-person options for kids to be in school. We have a college drawing students from all over the country. We haven't identified classroom outbreaks at our college or in our schools. We've had a really robust tourism economy. I think people are aware that our sales tax numbers are up. Our airport operated at twice the national average this fall. We have had the highest level of occupancy for our lodging of anywhere in the state. So we've really done a good job as recovering from this virus locally, maintaining control of the virus and getting our economy back open. So we are proof that you can do it. We have maintained, we've been in the bottom 10 counties across the state for per capita level of virus up until this time. So until this time, we have been really, really good at Southwest Colorado, La Plata, and Archuleta counties for containing virus and getting things back open. We are a model for how we can do this. The problem is that when you're this successful, COVID-19 starts to be background noise. We forget how important it is, and we forget how difficult it is to maintain the activities that we're asking people to do to control virus in our community. We want people to know the worst of this is not over. The virus is roaring back all over the country and roaring back here in Colorado, and we are afraid that that is going to happen in Southwest Colorado next. Currently in the state of Colorado, we believe that 1 out of every 219 individuals is infectious at this time. So activities that you got away with in the last couple of weeks and months, you're not going to be able to get away with anymore. So we have to really double down on our efforts. All across Colorado, counties are tightening their restrictions. We have tightened ours a little bit, but we are trying really hard to say, if we make the right choices, we can keep our schools open, we can keep kids educated, we can have a workforce that's able to be out there working and getting paychecks, but we have to do this together. All over the state, the testing is not happening at the pace that we need it to. Public health departments are not able to continue to investigate disease. And if this gets away from us now, we're going to go into a really difficult winter time. So we want to acknowledge that everyone has worked so hard to keep us safe so far. and keep us really doing well as a community, it is now time to remind everybody we have the power as a community to do the right things. We're going to stay home whenever we can, work from home if you can, avoid large social gatherings, keep your household guests to the minimum that we're asking. Remember that 1 in 219 people is currently infected in the state of Colorado. So this is the time to get tested if you have symptoms, and wear your face coverings, keep your distance, wash your hands, all of those things. And we can do this as a community, and we're going to hear from our other community members about why this is so important. Thank you.
Thank you, Liane. We will now hear from Kym. And I failed to mention, I'm sorry, I failed to introduce Dean Brookie, Mayor of Durango. He will also be speaking. But right now, Kym LeBlanc-Esparza, Superintendent of Archuleta School District, will give some comments.
Good morning. Thank you for the opportunity to speak on behalf of the school districts that operate in Southwest Colorado. All of us feel incredibly fortunate that our students are able to do at least some form of in-person instruction at this point. As Liane said, it's incredibly important to think through the lens of not only in-person instruction being the best instruction, the most engaging, the most optimal opportunity for students to learn, but we also have to recognize in Southwest Colorado, one of the dynamics that we all operate within are certainly limitations of connectivity, whether it's broadband or cellular connectivity. And so if and when our students are forced back into remote learning or hybrid learning, it certainly impacts the effectiveness. We can speak from experience. I've got Chris Hinger with me, who's one of my middle school principals. I asked him to attend as well, just in case we had questions from folks that wanted to know about what the experience is like for our students at this point. But what I can share with you is, our students are appreciating being able to be in school, even with having to wear a mask, even with having to socially distance, even with having to cohort. Our students absolutely appreciate the interactability that they have, the relationships that they have with their teachers and with their peers. And they are able to do that safely as long as our community continues to support us by making the right decisions around following health orders. So we would implore folks to certainly continue to follow with the guidelines, because we feel incredibly fortunate that we have been able to operate up to this point, K through 8, 4 days a week in person. And in fact, our high school students will start 4 days a week beginning Monday. And so while they've been hybrid up to this point, they are very eager to engage in 4 days a week of in-person instruction and ready to do so, and do not want to have to end that very abruptly right after we get started. So we certainly would encourage folks to please work toward community wellness in whatever way you can, because you are helping our schools to operate safely and successfully. So I appreciate the opportunity to say that today. Thank you, Liane.
Thank you very much. We will hear next from Dr. Rhonda Webb, CEO and Chief Medical Officer for Pagosa Springs Medical Center.
Thanks for the invitation to participate. For those of you who don't know, we're a small critical access hospital and rural health clinic. We have 11 beds for our license, and we have an emergency room. We've now been able to go from 1 negative air pressure room to 5 negative air pressure rooms. But what we do not have is an ICU. We have a surge plan in place, and our surge plan can accommodate up to 25 patients, 2 on ventilators in an ICU, and we don't ever want to go to that level. We rely tremendously on Mercy Regional Medical Center for transfers, for hospitals in Denver for transfers out, for Albuquerque. As we watch what's happening in other parts of the country, my colleagues and family in Louisiana and in Texas, and watch these areas that are hard hit now by the coronavirus cases, they're not able to send people out of their rural hospitals sometimes. I know that Texas Tech is at capacity. They can't bring in patients from rural areas because they're at capacity. And that is what we want to avoid here. So we will, again, implore people to follow public health lead on this and wear your face covering, social distance, stay home when you can stay home. We're all tired of it. Me, as much as anyone, I'm a social creature. And but we have to learn to live with this pandemic so that we can live with this pandemic and not have unnecessary loss of life, unnecessary loss of healthcare workers. And we, you know, we're following the rules. We wear our masks in the building all the time, and we try to stay as distant as we can. But we want to keep our economy open. We need to keep our hospital open because we have a tight margin like every other business in this area. And we have been rewarded, I guess, for all the work that's been done by all of our community members to keep our numbers low. And as we start seeing elevated numbers around our state and around our country and around our world, we have got to get serious and try to keep it down as much as we can so we don't have huge viral loads. So I will, anyway, I could talk all day, but I will stop now. Thank you.
Thank you very much. Next is Michael Murphy, Interim CEO for Mercy Regional Medical Center.
Hi, good morning. Thanks for the opportunity to be part of this this meeting. Certainly, Mercy as part of Centura Health has been part of a statewide collaborative with our chief medical officers and our chief clinical officers, looking at the trends across the state since March and continue to evaluate those and trying to come up with what are the best practices and sharing of information as we've gone through this. So we've had this incredible learning opportunity that we've benefited from as a system. And I guess most importantly, as we look at the numbers continue to increase across the state, our ability within Centura with the 17 hospitals to look at how we can move resources. So we feel very confident that as the numbers increase, the capacity and our ability to meet the challenges is still very much in place and robust around that. However, to echo some of the earlier comments, with the holidays approaching, I think we really have to be very diligent and mindful about our attendance at in-person indoor gatherings. Even those with families and friends, I think we have to think about. Unfortunately, these environments have the potential to become significant spreading events. We know that this virus can be a silent spreader, with the infectious peak occurring during the pre-symptomatic phases, and many individuals being asymptomatic out there. So I think it's incredibly important to emphasize the limiting of our exposure by avoiding extended family gatherings and to think about that. Even small gatherings with family members outside of our intimate family are clearly a primary area for potential spread. So following the proper guidelines that's been laid out, I think being diligent, as Liane mentioned early on, will be critical for us to be able to maintain the track record we've had in terms of managing this. We continue to have a top priority of our own caregivers of keeping them safe and following both the Colorado Department of Public Health and the Centers for Disease Control guidelines in terms of how we work with our teams locally to maintain their safety as well as those of our patients. We are, as a hospital, continuing to be very diligent about limiting visitors to the hospital only when absolutely necessary. And so that's a key piece as we look forward. So we look forward to continuing to partner with all of our healthcare providers and community agencies in the area to try to keep a handle on this going forward. So thank you for your time today.
Thank you again. Next is Dean Brookie, Mayor of Durango. Dean, you're still muted, sorry. Can you unmute?
Thanks for that technological advice. Thanks so much. Sorry about that. And thanks so much for allowing me to say a few words. And I'm not as medically oriented as some of the previous folks, but watching our community in the city of Durango, we're entering a new phase of this pandemic clearly. And it's alarming in our own community, not at the scale of many other communities throughout the state, but as we witness our restaurants, a number of them having COVID outbreaks, our construction sites, and in fact, our own fire department is severely impacted at this point in time. And when, in addition to the medical facilities, when we start to look at problematic levels of COVID in critical events like fire protection and emergency services, that's when we start to really understand how important our behavior is towards keeping our freedoms, if we want to call them freedoms, but I just like to think of them as a life in Durango. And especially when we're entering a new phase of and a new crop of visitors to Durango with this winter season. I've been working very closely with Colorado Association of Ski Towns, trying to figure out the protocols where we can in fact accommodate these new visitors and welcome them, as well as and protect them, as well as our own employees at ski areas, restaurants, all the entertainment and things that we want to keep open for ourselves, as well as offer a great visitor experience to skiers this season. So it's really important to continue. We are not, people talk about a lockdown. I haven't, as in the past 9 months, I've never felt personally like I've been locked down. I've been able to enjoy a number of new things, actually, and enjoy my own home, the trails, all the things that we have to do in Durango at a much higher and appreciated level than I ever did before. And so it's time to just kind of recapture some of those moments that we can and use this COVID period of time to be a little more introspective if you want, but it's not rocket science, but it is science. It is medical science, and it's here. It's real. The physicians have talked. My girlfriend is a pulmonologist at National Jewish Hospital. She, within the past hour, just pulled the plug on a COVID patient that had significant pulmonary problems, and so. Once that happens, it can happen to anybody. It can happen, as we know, to 20, 30-year-olds is one of our higher percentage rates of new in this new wave of COVID. So I just like to have everybody in our community be good behaviors. We know there's a few bad actors out there. It's okay. You don't have to go to those businesses. But we really need to focus our resources as a community, as the city, as San Juan Basin Health, on the bigger picture. And that's why I would really like to, during the next holiday season and as we enter the ski season, encourage everybody to simply wear a mask and do your social distancing. It's just not that difficult. And with that, I'll be quiet and hope that everybody has a wonderful holiday season. Thanks so much.
Thank you, Mayor Brookie. Next up is Jeff Dupont, Associate Vice President for Student Affairs at Fort Lewis College.
Thanks, Claire, and thanks, Liane, for having us on this call. It can't be said enough that we're all suffering from COVID fatigue and looking forward to life beyond this pandemic. I can't imagine what it would be like to be a first-year student in college and finish your senior year online and then join a college community in this environment. That'd have to be pretty tough. But we're really calling on our community to remain diligent, especially with the holiday weekend approaching. This semester, FLC has stressed the importance of protecting the nest, and our students and employees have done an amazing job of protecting each other and abiding by our mitigation strategies. We're really proud of the work the community has come together and done. We're also grateful for the work of our local public health department. We've really worked closely with San Juan Basin Public Health. We've worked hard to reduce any risk of exposure within our community, and just really grateful for the work that all of you have done to support us. With Halloween activities going on over the weekend, I think a lot of us can remember what we did at Halloween when we were in college. And so we really need to remind our community to limit private social gatherings, be smart, stay away from the big parties, the super spreader events. One of those events could really set us back with all the work we've done to this point. And we're just really focused on finishing the last 3 weeks of this semester in person. We've got 3 weeks left. And if we can get our community to focus for these last 3 weeks, we'll be happy to finish, with a healthy community moving forward over the break. So thanks for having me on the call, and I look forward to questions after this.
Great, thank you. It looks like we do not have Commissioner Steve Wadley with Archuleta County, and so that means up next is Commissioner Gwen Lachelt with La Plata County.
Great, thank you so much, Claire. Can everyone hear me okay?
Sure can, thank you.
Well, I really wish we weren't having to do this urgent news conference today. This pandemic has been a long haul, and sadly, it looks like we're in for a really long haul. We are in an even more critical place today than we have been the last several months. And as elected officials, our job is to protect public health, safety, welfare, and the environment. And we can't do that without every single one of us stepping up to do all we can in the next few weeks to protect our own health, our families, and to avoid a run on our healthcare system. We simply can't afford to overwhelm our hospitals and caregivers, and we certainly don't want to have to go into another shutdown. This pandemic has affected every single one of us, and it has taken a toll on all of us, but it's so important not to give up. Don't let your guard down. This pandemic has tested our patience, our sense of humor, but the rewards of staying strong and continuing to wear our masks, practice social distancing, and staying home will reap great benefits. You can take pride in knowing you are doing your part and standing up for yourself, your family, and your neighbor. We all want to be able to look back once this health crisis is behind us and know we did all we could for our community. Thank you.
Thank you. Liane, would you like to give closing remarks and then we can go on to questions?
I would. I really appreciate everyone jumping on this call and sharing. And I know there are some, we also have other individuals on this call that are not available for questions. So thank you to Animas Surgical for being here. Thank you for Ignacio School District. Thank you for the Southern Ute Indian Tribe, as well as the folks that we've heard from. I think what's really important is to understand that we as a community have evidence that we can be successful, and we are moving into another challenging phase of this. So just to level set where we are as a state, for about 8 weeks, we were averaging 500 cases a day. We had about 200 people in the hospital across the state of Colorado. We're now getting 1,800 to 2,000 new cases a day. We have 600 people in the hospital. The highest number that we had in the hospital back when we had very little infrastructure for this was just about 900. We expect to have 900 people in the hospital in the next week to 10 days, right? So things are across the state just not looking good. We have a 6% positivity rate, which means that our testing is not, meeting standards for what's adequate to know your level of disease. We believe that, I think we talked about this before, that 1 out of 219 Coloradans is infected at this time. We believe that overall, maybe 8% of us have had it across the state. We don't know how long immunity is conferred, so we don't know if people will be getting it a second time, right? I give these stats to really stress that we have been successful. We have our schools open, we have our college open, we have very limited outbreaks, where our economy is recovering. We're at this pivotal point where we can see everything that's happening around us and say that as a community, if we start to make adjustments and make them now and make them fast, we can stay ahead of this. If we fall behind, we're not going to get, it's much, much harder to climb out after you fall behind. So we're going into a holiday weekend. It's Halloween. We want people to enjoy their holidays. We understand that this is hard on us. It is hard on our families. We're smart people. Get creative. Think about new and interesting things you can do. Take advantage of warm days when you can be outside with your family. Do things in smaller groups. Do things over the internet. work from home, don't go out if you're symptomatic, right? What are like the really creative things we can do as a community? If we need to move as many activities outside as possible, then let's get together and do more, winter coat drives so that everyone in the community has the right gear to spend more time outside. There are like little tiny things that we can do that are going to make gigantic differences. And I'm just asking that we continue the work that we've done for the last 8 months and carry it forward. To be a successful community and capitalize on the work. I know we're smart people. I know we're creative. I know we can get through this together. And thank you all for being here. I don't think I have anything else to say. So I think, what do we do next? Go into questions?
Sure, yes, thank
Okay.
you. And we do have 2 questions. They are both related to enforcement. The first, why can't the local government enforce the mask orders? Couldn't city council pass an ordinance that would allow police or health officials to fine individuals or businesses that don't comply? What is the purpose of a health order without an enforcement mechanism? And the second question is related, I think, answering the first one will answer for both. So Liane, do you want to first address, and then we can certainly allow some of our government officials to speak to that as well.
I think that this is an extraordinarily unfortunate discussion to have in the first place. We're all trying to do the right things, and doing the right thing is how we protect each other and how we keep kids in school and how we keep people getting paychecks. So I want to start with, it's unfortunate we have to have this conversation. We wish that people would, try to do the right things as a community. And the evidence is that the overwhelming majority of our community members have done the right things. That's how we've been able to recover and keep schools open and keep a college open and keep tourism coming to the community. So that's I think that that's the important conversation to have. We get to determine what our social norms are as a community. We get to be leaders. Every single one of us is a leader right now. So if you do the right thing, you will inspire others to do the right thing. San Juan Basin Public Health is focused on disease investigation and control. We're like the firefighters putting the water on the fire, which is containing disease, and we're building the fire line, which is reminding people about how things can spread. And that's where we are focusing our energy. We have to keep our focus on containing the fire the way that we are, which is disease investigation and control and stopping spread through outreach and education. It does take a whole of community and a whole of government effort to get through all of the pieces that have been developed really quickly in this pandemic. And we continue to work with partners to get to the next steps.
Thanks, Liane. Would one of our other government officials like to also respond? Looks like Mayor Brookie would. Thank you.
Gwen had her hand up first. If she likes to go ahead, but I do have a few comments as well.
Sure. Thank you, Mayor Brookie. Just a few comments. We are certainly putting our heads together with our public health partners, our other local governments in the region, the state health department, to really to tackle this issue of enforcement. It's unfortunate we have to have these conversations when this is all about all of us. But in the meantime, I really urge members of the public to make your concerns known to businesses that you don't see complying, and, vote with your pocketbook, support businesses that are trying to do the best thing for the community.
Thank you, Gwen. I echo that as well, and want to reiterate Liane's comment that we, in fact, in our community, in Durango specifically, we have between 60 and 70% compliance with our mask law across the board. So that is within the realm of a success relative to and the number that we need to continue with to make any advancement towards management of the pandemic. So we do have a couple bad actors, and that's been in the press, and they've used it as a political platform. They've used it as using, unfortunately, the use of masks as a, just using one of our street corners to make a political statement. So when that happens, my personal advice is to not give them any more free press than they already deserve. I know I got a call from the New York Times. That's not the kind of advertisement we want to give in our community or to any particular business. And so I'm looking forward to the day like Tuesday next week after, so we can push aside the political aspects of this entire pandemic and move forward into the medical and more and really focus our resources, that being money and personnel, and that being the city, the county, and San Juan Basin Health Department to really aggressively do what we're trying to do and have done over the months, which is to educate our people and roll out these policies that are for the benefit of the health, safety, and welfare of our community. So that's a long answer to say I'm not really worried about one bad actor on the corner of College and Main. And as Gwen would say, you know, how much yogurt do you need in the middle of the winter? You know, and maybe we won't have this problem next spring with that particular entity. But by and large, I just want to give a shout out to all our merchants, our bartenders, our restaurants that have really implemented and spent money to comply with all the various COVID policies that the governor has rolled out and we've implemented. And lastly, City Council is looking at more strict enforcement. And again, we do have a governor's order for mandatory masks throughout the state of Colorado. Durango was implemented our mandatory mask policy prior to the governor issuing that order. But once the governor did that for as a uniform policy throughout the state, the city did let ours sunset. So we still have that law for everybody. It's a mandatory mask ordinance. It's interesting, people coming from the outside tend to get it because they're escaping areas that are higher levels of COVID than we have oftentimes. And so they're coming here to be safe. And so ironically, some of the, you know, I've seen a high preponderance of good behavior by our tourists as they come to our community. It's our job to protect ourselves and to offer our own protection from those visitors that are coming from other parts of the world. So with that, I just want to, you know, we are taking enforcement it's very, very serious, but it all comes down to one, money and expenditure of resources. So you know, I think in general, we're doing a really good job. What we can't do is become complacent. And, you know, I think I mentioned the election. I think we're all a little preoccupied with the election right now. And I look forward to post-election when we can all really focus on what the task ahead of us to keep people aware and expect of our citizens the good behavior. And so we can also be above the noise that's occurring right now in terms of misinformation regarding the pandemic and really focus on how we get out of this moving forward. So thank you.
Thank you very much. We've got a couple more questions. We might not get to all of them, but I would like to at least get a couple here answered. So the first one is, what will be the threshold for closing schools in the area to keep educators safe?
So I'll start and then we can turn it over to some school partners. You know, we are in discussions with San Juan Basin Public Health is working with higher ed and K through 12 every day, our staff. And I think, I hope I have done this already, but huge shout outs, huge thank yous to San Juan Basin Public Health staff who is working tirelessly on it, as well as staff at every school district and at higher ed. You know, communicating daily about cases, looking at numbers, investigating positive cases, and getting cohorts tested and working through the guidance and the rules that are available for school districts and higher ed. There is not a set threshold. It is an ongoing discussion. We have lots of precautions in place. Of course, we're getting positive cases in schools because we have community spread. We are not demonstrating levels of transmission in school settings, because our schools are doing such phenomenal jobs with the precautions in place in the schools. So what we are finding is transmission is lower in the school settings than it is in other places in the community. And we are in constant discussion around that with testing to ensure that we have a handle on this. And so we don't have a threshold set as a community. It is something that we are discussing day to day.
Superintendent Fuschetto, would you like to answer?
Sure. Thank you again for doing this. So all of us, we're on the same page county-wise and including Archuleta County. As for Ignacio, we have that discussion with the board. We always thinking about 10 to 15%. If our students are quarantined, then we'll have to really consider shutting one building or all buildings, depends the spread. In reality, in Ignacio, yes, we have a quarantine of 2 classes and quite a few teachers on an individual basis, but we've been very, very careful. Even without having test results, somebody has come to us and say, hey, this kid or this parent has tested positive. We have been very cautious and we have quarantined our staff and our students. So that's been great. The issue that I had to face with a few angry parents and I that want to come into the buildings now wearing masks. I say, no, first of all, we're very selective who's coming into our buildings. You refuse to wear your mask, you're not coming in. And I don't care what your personal beliefs are. Whatever you do across my sidewalk, that's up to you. But once you step on school property, we're a public entity and we have a mandate from the governor to wear masks. You will wear a mask. I really appreciate what the Southern Ute tribe has done, keeping the business closed and the tribe closed. I think that's what prevented us from having a huge number of COVID cases. So, and probably all of you know, there's some disagreement in the town in one of our businesses, but we keeping our heads on top of things, and we emphasize every day wear mask, wash your hands, keep social distance. And cohorting our students has been a great help, because in case of us have to send the whole school home, we have just a small group that will be going home. So those are my 2 cents. Thank you.
Thank you very much. So I did want to get to a couple questions from the Durango Herald, some of which have been answered. One maybe for Liane, and then one for Michael Murphy from Mercy. So the first is, as cases rise, how will San Juan Basin Public Health balance health and economic needs? Oh, sorry. So I think we addressed that one. Sorry, there was another one. Under what circumstances would San Juan Basin Public Health order businesses to shut down their in-person services?
Okay, well, for balancing health and economic needs, I mean, I think there are other government partners that can talk about. There are programs still available, local and statewide programs, to help local businesses both successfully make adjustments to have precautions more available in their businesses. And there were additional funds available for local businesses for revenue losses that were made available through state programs. So we can get local governments to get some information out around those things. And then as far as the thresholds, we are in safer level 2, which the state of Colorado has public health orders. There is the stay-at-home public health order, which we all experienced March and April. At the end of April, the state transitioned to safer at home, and safer at home was supposed to be the kind of transition step from stay at home to protect our neighbors, and protect our neighbors was going to be the long-term restrictions, potentially for 1 to 2 years, as we were learning to live with the virus. As Dr. Rhonda Webb had so eloquently said earlier, this is part of what we're doing. We're learning how we're going to live with this. Unfortunately, because we've had rises periodic rises in cases in Colorado, there are not a lot of communities that have gone to protect our neighbor. So Safer at Home has 3 levels of restrictions. It's Safer 1, Safer 2, and Safer 3. And those, there are metrics that are predetermined to indicate which one of the gradients of safer a community is in. And those are the metrics that determine if we would have to have more restrictions in businesses. So all of this is available on our website. It has to do with how many cases are identified within 14 days per 100,000 residents. It has to do with hospitalization rates. It has to do with adequate testing in your community. These are predetermined. These are in state public health orders. If we see continued rise in cases, we would have to have additional conversations about whether we stay in Safer Level 2 in La Plata County, we're in Safer Level 1 in Archuleta County, and what restrictions would happen if we move to Safer Level 3 in either county. So it is very detailed what happens to each type of business and each type of sector if you have to take a step backwards. We are here today having this call to action, which is about what we can do to make adjustments as community members right now, so that we don't have to have these discussions about what happens when businesses that are currently operating at 50% have to go down to 25%, or certain businesses have to close altogether.
Thank you. Did anyone else want to address that, or shall I move on to what I think will be our last question? Okay, so the last question posed by the Durango Herald. During the first months of the pandemic, Mercy did not release critical information like bed ventilator capacity to the public in a timely manner or at all. Will Mercy commit to greater transparency in the future, particularly as we manage rising cases? So Mike, I think that one is for you.
Sure, yeah, I'd be happy to answer that. We continue to provide daily data to the state health department in terms of our current levels within the hospital. And we believe that is the best public source for hospital data related to this pandemic. So we continue to do that diligently. Hospital, as you can imagine, hospital specific data on a daily basis changes multiple times a day, with patients coming in and leaving and fluctuating. And as I mentioned earlier, because we're part of a 17 hospital system, our ability to garner resources, I think, is incredibly positive and supportive for the community, that we can access that throughout the system. So I think that is the best way that we continue to partner and collaborate to provide that level of information to the community.
I think the other thing to really keep in mind is it's a system. The state is working, right? What we've talked about is that hospitalizations across the state were under 200 for, the last 8 weeks. They're now at, I think, over 600, with potential for going to 900 in the next week to 10 days. So all of the pieces have to work together, right? So part of the reason we're having this call to action here locally is that local capacity isn't going to decide everything that happens to us, right? We as a community, if we do a really good job containing virus and we contain it where we are now, and the rest of the state is not able to contain virus, we're all going to be out of resources, whether they're hospitalizations, testing supplies, PPE, ventilators, right? And we've seen that happen. Some of why the northern Colorado hospitals have filled up is because Wyoming has been having a really hard time containing virus, and patients came down, right? We are seeing this happen all over the country, where states have to work together to treat patients, and then within the state we have to work together. So the resources that we have are going to be limited in a multitude of ways, and the most important thing that we need to be doing as a community is containing virus for ourselves, so that we do not need additional healthcare capacity that is not going to be available anywhere if everybody's cases rise at the same time. So I just want to keep coming back to, we own this problem. We can put in precautions as a community and we can move forward safely.
Thank you.
Dr. Webb.
I think Joe Theine also would like to respond as well. So maybe Dr. Webb first and then Joe, or vice versa.
So I just to make people aware of just how serious we are, today we'll have our first drill from Colorado Hospital Association with the Combined Hospital Transfer Center. Colorado Hospital Association patterned this after other communities in our country. So we will be having a drill to determine when when we were at a surge, the normal way we transfer patients to another higher level of care will change if we continue to increase. And they have pulled together some resources to make certain this is as seamless as possible. But we're having our first drill today, and that means that they are taking this seriously because, like Liane said, we'll be at 900 cases soon, and we don't want our system overwhelmed. So thank you.
Joe, we can't
Joe,
hear
I
you.
don't think we have your audio.
Yeah, and it looks like you're unmuted. Try now.
Is this better?
Yes.
Yay. Life in Zoom. Just wanted to first thank Liane and Claire for hosting, to my colleagues, Dr. Webb and Mike, for all the work that the hospitals have been doing together. You know, as Mike's talking about, and we're talking about statistics to publish, you know, the stats are well beyond just ventilators or bed capacity or things like that. I think one of the key messages is that the ability for a hospital to serve the community is dependent on the staff of the hospital, the availability of supplies, PPE, and other things. And so there's not one measure of hospital capacity that could be published. And really it highlights the importance of all of us working together as a community. We've got a 13-year-old child. My wife's a healthcare provider. If all of a sudden I go home and have COVID and expose my child and my spouse, the hospital loses capacity to care for patients. If a nurse in our hospital it has a child who's in school and one of the other children brings COVID into the classroom and that child brings it home to a nurse, our hospital capacity declines. And so it really just highlights how intertwined we all are, and the decisions that we make each and every day right now really affect the ability for our hospitals to serve. And so while looking at statistics is helpful in the community, our actions right now are probably what's most important.
Great, thank you very much. And with that, I think we are going to wrap up our press conference. Greatly appreciate the questions from attendees and for all of the comments and insight from our panelists. Thank you all very much.